everybody. Welcome back to Becoming a Therapist. Today, I have with me David Smith. He works with neurodiversity, so ADHD and autism, and then also a lot of complex trauma. And this is via telehealth. David, thank you so much for coming on my show.
I'm happy to be here.
I want to kind of start with hearing your therapist origin story.
Mhm.
Obviously, a lot of my population are thinking about becoming a therapist or actively becoming a therapist. So I want to hear how you would tell the story of how you got your start.
It was a long and complicated path. Um, so, back in the day when I was a brand new college student, still wet behind the ears, I actually thought about becoming a therapist because I was fascinated by psychology. And I did some volunteer work as a date rape prevention counselor and a volunteer at a drop in crisis center and things like that. I quickly didn't realize, I was wise enough to realize that even at that age, that I didn't have the kind of boundaries around transference and countertransference, as I would now call it,
Mhm.
that would allow me to survive that field at that time. I just took it home with me and then would lie awake all night or all day thinking about the stuff that I had heard. So I chose another path, went a different direction. Did a lot of other things with my life. You may not be able to tell I'm actually older than I look. I'm 57. So by a series of random events, when I was a stay-at-home parent, I went back and decided to get a master's degree, but not in anything related to counseling. It was a Master of Fine Arts in Writing, fiction, no less. And along the way, we had to write a critical essay in our third term and then a thesis, which in my case was my novel. As it turned out, I chose to write my critical essay on complex trauma as it appears in fiction, in several different books that I was just fascinated by. And I wound up becoming so much more interested in the research and things that I was discovering in learning about complex trauma that I wound up kind of losing interest in my novel, which is still incomplete. And then I did get my degree. And then about 6 months later, I was in a men's group, and one of the other participants and I were having a deep conversation about I forget what. And he just paused and he said, "You know, you're really good at this. Have you ever thought about becoming a therapist?" And it's one of those things that just kind of kept echoing. And so then I told my then wife that I wanted to go back for a second master's degree. Of course, first I had to get all the undergraduate training in psychology that I would need to even be able to apply because my degree was in literature. She was mm, less than thrilled about us paying for a second master's degree 6 months after I had just completed the first one. But she ultimately went along with it. And so I went to I did a lot of research about the right path. I chose social work just because it seemed to be the sweet spot of flexibility and training time. I didn't have the luxury living in small town Southern Oregon to relocate my whole family to go to a PhD program. I was also 50 years old. Um, so investing, 5 to 7 years plus training time to become a PhD level therapist was not in the cards. So I did my research. I chose Simmons online, which I highly recommend. It was an excellent program. I never stepped foot on campus until I graduated, but met some amazing people. The professors were almost universally excellent. The price is higher than some, but I had a really good experience there. And then I did my internships as so my original intention had nothing to do with what I'm doing now. It's a completely different path. I wanted to specialize in complex childhood trauma uh, for lots of reasons. Like most people, I've been through a lot in my life, and my family has, and so I went into this work in part to learn how to heal myself and people like me. I'd been in and out of therapy since I was 19 years old, so um, so I wanted to. thought I wanted to work with children and families. And that's what my internships were in. That's what my first jobs were in. I was a school-based therapist as I was working toward my license, working in elementary schools. As many of your audience will know, the process of getting toward licensure working for community mental health agencies is brutal. Had a couple of episodes of severe burnout, one of which landed me in between jobs just as COVID hit. So I was without an ability to gain my hours for quite a while. And then I did go back. There's only a handful of people still seeing kids in person before the schools reopened in this area, just because I figured they'd spent way too much time on screens already. And I was often the only person in the school seeing children. All the teachers were there in their rooms with their little Hollywood squares going on. But I had special permission to bring kids in and out, which was cool for them. Risky for me, but I'm here. But long and the short of it is that it took me 5 years from the time of my graduation in 2018 to my licensure in 2023. Social work in Oregon gives you between 2 and 6 years, minimum 2, maximum 6 from the time you start your process. So it was longer than average. It happened that the schools, all 3 of the schools that I was assigned to during the course of that path, happened to have the magnet programs for children with sensory issues, with autism, with learning differences, both those that are really heavily impacted and those that are close to being able to go into a mainstream classroom successfully. And so as a school-based therapist, I was getting a much higher than average number of referrals of neurodivergent children and their families. And I had, like almost anyone going through grad school, unless they specialize in it, I had about 10 minutes of training in autism. Here are the diagnostic criteria. As anybody who is autistic or works with this community knows, they are vastly out of date and miss 95% of those of us who would now identify as autistic. I did not then know that I was autistic myself. I didn't learn that until way into this process, like last year, after I'd been working with this population for about 8 or 9 years. But I had the choice of either learning what to do to help neurodivergent people and their families and their teachers, or referring them to someone who specializes in that. And anyone who is connected to the neurodivergent community will tell you that finding a qualified therapist who knows anything beyond the basics about autism and is comfortable working with them is like trying to find a rainbow unicorn. So I chose to learn. And thankfully, my supervisor at the time had an autistic grandchild and was very encouraging and gave me a lot of good resources. And so I started working with more and more neurodivergent people and families. When I got my license, my intention was to, at that point, I was pretty burned out. It had been a long and difficult road. And I decided to start a private practice with the encouragement of my wife, who is also a therapist, but licensed in Peru. And she'd been working online across 3 continents for 20 years, all telehealth. And I had all kinds of preconceptions about what going into practice would mean. I would need an office. I should be part of a group. I would have to see clients in person. I would have to find a comfortable couch, all the usual stuff. She said, no, you don't need any of that. And she encouraged me to do what I now do, which is to set up a practice from my own home, completely remote. I don't see anyone in person. And to just do what I love. And one thing that I learned in working as a school-based therapist is that although I love working with children, and it's wonderful to be able to see them blossom and grow and play and all those things from where they start, the work that I actually was better at and enjoyed more was what I was doing with the parents and the teachers around those children. And so my practice shifted completely. I'm now when I set it up, I work not exclusively with adults. I occasionally have kids who are, kind of in the tween to teen range. And I have a few people who are in their 70s and approaching 80 occasionally. But the bulk of my practice is people, from 20 to 60 who um, are working with complicated issues. I made at the time, complicated decision to, in Psychology Today, I don't know how familiar you are with it or your audience, but, when you set up your practice, you check off, you set up a profile on Psychology Today. It's the main way we find therapists. Mental Health Match is another good one, but ET is the big one. They give you a bunch of boxes that you can check off about what you work on. I thought long and hard about whether or not to check the box that said I work with autism. Because at the time I had experience, but I was not specially trained. I couldn't say that I was any sort of an expert. Um, I knew that autism is complicated. I didn't have any specific interventions that would work with autistic adults. I knew how to work with, autistic children to some degree. But I did. I checked off the box, and the floodgate opened. It turns out that it is very, very difficult to find a neurodiversity-affirming therapist. Um, and when I say that, I have a specific meaning in mind. So not just someone who works with autism, but doesn't see it as a disorder, doesn't see it as a developmental disability, although it can be in its more extreme manifestations. Just sees neurodivergent people as people with complicated nervous systems and often complicated lives. And works with, in my case, I work with the entire being. So it's not just talk therapy, it's things that I picked up from contact with occupational therapists about sensory and somatic techniques. It's a lot of stress management because stress is at the root of everything when you have this fragile nervous system. But also these interventions also work a lot with complex trauma for different reasons, also fragile nervous systems that are often dysregulated. And then eventually I went back and got some more complicated training, became a certified autism specialist, although I would not consider that a very meaningful qualification, really. And more my client population, which as a solo practitioner averages anywhere between 50 and 55 people at any given time. No, I don't see that many clients a week. That would be insane. It averages between 28 and 35, which is still a heavy workload for a single practitioner. But an increasing percentage of them are either diagnosed as autistic or suspect that they are self-identified, are playing around with the idea someone told them that maybe they're autistic, and by the time they get to me, they've been through probably anywhere from 3 to 30 previous therapists, depending on how old they are. And, may have found some things that help, but they have never worked with a therapist who specializes in neurodiversity affirming care. And as I started working with more of those people, I started learning a lot more about the different ways that neurodivergence can show up. My wife, who remember is a therapist with a lot of experience, including working with neurodivergent people, had been telling me since she met me, I think you might be autistic. And I kept saying, nah, it's just complex trauma. They look the same. I understand why you might think that, but nah. I know what autism looks like, I thought. But then my clients started calling me out. I specifically remember one saying we were having a discussion about some special interest that I had, and she said, "Dude, that's your autism showing. You need to look at this." And so the first thing an autistic client will ask a new therapist that they're trying out is, "Are you autistic yourself?" Basically, do you have street cred? Can you understand? Do you have any hope of understanding what my life has been like? And all I could say was, well, I don't know. My wife thinks so. But that started feeling really inauthentic. And also, when I'm working with people who have been through all this stuff around their autism, they've been through ABA potentially as a child. they've been through the full autism assessment, including the childhood versions that include several days of observation and talking to everyone around that person. I had not been through that process, so I felt like I felt like an imposter, really. And so I went to get the assessment. And by the time this brilliant psychologist, Benjamin Neely, had gone through all the screening questionnaires and did his the pre-screening interview with his assistant and then his interview with me, it only took him 45 minutes. And he said, "Yep, you're autistic." And I said, "Wait, don't you want to do some differential diagnosis? Talk about trauma versus autism?" And he said, "No, I mean that stuff is there, but you're clearly autistic." And it was like the world shifted, nothing had changed, and everything had changed. It was both no surprise at all at that point and a complete shock. And I went next to the next room where my wife and her mom were, and they said, "How did it go?" And I said, "Well, I probably had this 1,000-yard stare on my face. Well, it looks like I'm autistic." And my wife came up and gave me a big hug, and she said, "Of course you are." So, and that was about a little over a year ago, and it fundamentally changed the way I practice, the way I think about myself. It was huge. And so I am more and more committed to the idea of providing neurodiversity affirming care and trying to educate people about what that is and why it matters. Because it is very hard for neurodivergent people, whether it's ADHD, autism, some of the lesser thought of ones like dyscalculia, synesthesia, Ehlers-Danlos, epileptic disorders, all these things that make people's lives complicated. It's a full body experience to have these differences. And finding anybody who even has a clue what that means, whether they're doctors or psychiatrists or therapists or teachers or whoever, involves a lot more searching than it should. So I am at the point now where my wait list is 3 to 5 months long. I keep trying to get it down, but my clients don't like to leave, which I find flattering and frustrating sometimes. Um, I'm glad that they are getting a lot out of the work that I'm doing with them, but there needs to be room for more. So I'm at the point where I am changing the structure of my practice so I can hire on contractors, probably not employees to begin with, who have similar practice styles of different specialties. So not just therapists, but I'm talking to an OT, because occupational therapy, if you can find an OT who works with neurodivergent adults, that's even more of a unicorn than a therapist, mental health therapist. They are worth their weight in gold. They're very rare, but a multi-specialty practice that focuses on providing excellent care to neurodivergent people. And then also I'm trying to do, sorry about the noise, trying to do more speaking and podcast appearances and training and education and writing and other things. So I'm a busy little beaver.
Yeah, you are. There's a lot going on.
Yeah.
And I mean, what a needed niche. I do feel like, especially with kids, like the therapists who are willing to take on these types of populations really do fill up fast.
Mm-hmm.
But like you said, there is this special training, and like the interventions do have to be more accommodating of just like the unique concerns with overstimulation, with all of that kind of stuff. So I'm curious, how do your therapeutic interventions change with this population?
Um, it is very customized.
Okay.
Um, so ironically, it's actually easier to find a therapist for a neurodivergent child than it is for a neurodivergent adult.
Huh.
Um, in part because people still think of autism and ADHD as childhood concerns. It doesn't occur to a lot of people that those neurodivergent kids grow up into neurodivergent adults. It doesn't go away. It just
Mm-hmm.
shifts. The nature of it shifts, and hopefully we build a few more skills and maybe figure out, usually by intuition, what helps. Um, but there are some aspects of it that are really not well known. So a lot of what I'm doing, especially in the early stages, is normalizing some of the things that these people have experienced all their lives, and they thought they were the only one. So, for example, if it is almost universal, not quite, but almost universal for autistic people to have lifelong issues with GI problems, sleep disorders. Um, there's such a clear and well researched link between autism and differences in the gut microbiome that it's not clear whether they're cause or effect or just so interrelated that they are hard to separate. Plus, our nervous systems are just wired in these really weird ways. It's like, some mad scientist invented all this stuff and did a custom design job on you and never wrote a manual and then died. And you're trying to figure out how to operate this machine that simply doesn't function the way that you're told it should. You're supposed to push on the accelerator pedal and it goes, and you're supposed to push on the brake pedal and it stops. And sometimes the reverse happens. Why? This is weird. So they've often had these really complicated issues that no one can really diagnose. So yeah, I could tell that you're having gut pain often. Maybe it's anxiety. Um, take some Pepto-Bismol and see me in the morning. Well, no, this goes on for your whole life. Having someone who understands where that comes from and has the research and experience, lived experience, to be able to say, yeah, that's pretty normal in the population I work with. And here are some places you can go for help. Boom. It's miraculous.
Yeah.
It doesn't mean that the issues necessarily get solved, but even just the knowledge that you are not a broken, flawed human being that no one will ever understand, much less be able to help, that there are answers and people who can normalize this is a big deal. That's why so many neurodivergent people, when they read the book Divergent Mind, Janara Nuremberg's brilliant investigative journalism piece about the full spectrum, as she knew it, about female neurodivergence, has been so mind altering for so many people. Just the fact that there are words for things that we've experienced that we thought we were the only one, and it's just, this is bizarre. Am I crazy? Um, it's huge. So a lot of what I'm working on in the beginning is just basically providing psychoeducation. I'm kind of infamous for my handouts. My
Nice.
ADHDers tell me that they are TLDR. I had to look up what that meant. Too
That's
long,
funny.
didn't read.
Yes.
Needs more graphic, needs more interactive stuff. I'm working on it, people. There's only one of me, and that's not the way my mind works. Deep dives and a lot of words. I can't say my own name in less than 350 words. But so I do a lot of work in introducing people to the concepts of occupational therapy in terms of sensory regulation and somatic, polyvagal theory, proprioception, interoception. I introduce people to the idea of the window of tolerance for stress and what happens when you exceed your window of tolerance. You either melt down or shut down. There aren't any other options. We do a lot of talk about the limbic system and that it's not just fight, flight, or freeze. There's also fawn and flop and several other things that are not well known. And neurodivergent people tend to spend a lot of time in those zones. Um, and we talk a lot about nutrition and diet, talk a lot about exercise. I will freely admit to all of them that I'm not very good at practicing what I preach. I will spend a lot of time reminding them that I am not just, not an expert. I don't consider myself an expert in this. I'm still in the process of discovery, but I'm a fellow traveler on the journey who is, maybe if I'm lucky, a couple steps ahead of where they are and might be able to tell them, here, well, here's some paths you might explore. and more be able to introduce them to some other specialists, functional medicine, integrative medicine people who get it and also have really long wait lists. So, and then I'm also trying to educate other professionals, including other therapists, about how to help the clients they already have so that referring them to an autism specialist doesn't become their first response when they find out someone just got diagnosed as autistic or having ADHD. Oh, let's refer you to a specialist. No, stop. You've got a year of therapeutic relationship with this person. It's not like they fundamentally altered their whole being because we have this new information about their nervous system. Have a conversation for 20 or 30 minutes with someone like me who can help you understand how to adapt what you already know to do and find information that will help you cover the rest. CBT doesn't work the same way for an autistic person. It just helps them understand more and more why they're messed up. We remain messed up, just with greater levels of frustration. The CBT triangle, yeah, I mean, in theory, if you could change your thought, behavior, or feelings about any one of those things, you intervene in one of those spots, yeah, with a neurotypical person, things will typically change. But for a neurodivergent person, those aren't coming, those behaviors that are so problematic are not coming from any specific thought or feeling. They're coming from a nervous system reaction that's not under their control. It's in the limbic system, which has no access to the prefrontal cortex. It's the other way around. So what do? Well, some of the same things that you would do with trauma-focused CBT, only you're doing less of the CBT part. And you usually don't need to get into the trauma story because it's not coming from trauma, it's coming from a limbic response. So I don't know if that went down a longer road than you wanted to take, but
Yeah, no, that was helpful. So I'm curious, being in the field, controversial question, what do you think about ABA?
controversial question, yes. And in one of the agencies that I started out in, they had the county's ABA program. And I knew quite a few of the people who were in it. And they were universally very well-intentioned, very patient people, very educated. If you talk to people within the autism community, ABA has a horrible reputation, especially among the people who were the children who went through ABA.
Yeah.
My own perspective is that it can have value in certain ways. The fundamental question about ABA, though, for me, I mean, aside from some of the abuses and bad methods that have been used in the past and sometimes still are, and the fact that it is fundamentally kind of coercive, the bigger issue for me is one that isn't often asked. You are basically trying to teach an autistic person how to act less autistic.
Yeah.
And try to pretend to be neurotypical in a more compelling way in a broader range of situations. That to me is fundamentally invalidating. Now, if they're unsafe, if they are, many people with high support needs, is the current term that we use. I think of it as, heavily spiced. I think of, neurodivergence as like a spice mix, garam masala or tahini or whatever, It has a certain set of common ingredients, but every family has their own secret recipe and a few things they add to it, and they might sprinkle on just a little bit or dump the whole jar in.
I love that.
So, for those who are more heavily dosed, let's say, ABA can help to make them safer, help teach them skills for regulating themselves. It helps to calm down the family environment, which has its own value because often these households are very chaotic. I don't deny the value of it for certain families. I question the premise to some degree, and the methods are still ones that are often questionable in their ethics to me. That's my personal opinion.
Yeah.
I have talked to enough people who were diagnosed with autism as children and given ABA treatment and resent it hugely now, in part because it put them into a lifelong process of masking and camouflaging
Mm-hmm.
that they couldn't do successfully and are now trying to unlearn. So there is a reason for the controversy. I can see this is one of the things that I'm good at is seeing each side of a controversial stance. And I'll sometimes have my own opinion, sometimes I won't. I prefer to assume good intentions, even when the outcomes are not always what's desired.
Yeah, I think that's totally fair. And I think you did do a good job like of articulating both sides. It's complicated. We want to help, but also, help that comes from a place of ableism has its own consequences.
And
That
internalized
just
ableism is one of the things
yes,
that I'm constantly trying to unwind with the clients I work with because they take on the opinion of society, sometimes to the point where they're self-harming and calling themselves retards and other horrible names because they've
yeah.
internalized the messages so much. And when I try to offer a more compassionate way of looking at themselves, uh, they will argue with me. Say, well, you
Mm,
clearly you look at all the books on your shelves behind you and all the diplomas and degrees on your wall. You clearly are not me. You have not lived my life.
wow.
Um, you know, what right do you have with all your privilege to tell me how I should think about my autism? And that's fair. That's totally fair. I'm blessed to be able to pass, as they would say.
Yeah.
You would not, unless you were probably, I mean, autistic people tend to have something very similar to gaydar in the gay community. We can spot each other
Yes.
immediately. Uh, and, I wouldn't say there's any secret handshakes or anything, but it's usually not a surprise when someone comes out and says, yeah, I'm autistic. Yeah, I know.
Yeah. Yeah. Right.
Guessed that the moment you walked in the room.
Yeah.
Um, but yeah, I'm very aware that I have not had to deal with a lot of the things that some of my clients have. For among other things, you know, I when I was born, that was 20 years before Rain Man came out. I think it
Oh.
was 10 years before Temple Grandin even started um, her studies, much less was
Mhm.
well known. I mean, autism in the time that I was a child was we thought it was so rare. It was like 1 in 10,000, and there were maybe three specialists in the country who you could refer people to.
Mhm.
And the methods that they were using were, in retrospect, pretty awful. We didn't think of people anything like me, other than the fact that I'm white and male.
Yeah.
Um, and middle class or about that part of the profile I fit. But I did well in school. I had friends. Not didn't necessarily know how to keep them for very long, but I had friends. My teachers
Mhm.
loved me. I got along very well with adults. As you can tell, I'm very verbal. I make some approximation of eye contact, although if you look closely, you can see that I look away fairly often.
Okay.
The reason for that, if you're curious, is because eye contact is extremely intense for autistic people. It's hard to regulate. So we'll often look at the forehead or the nose or the chin or just look away every now and then. But
Mm.
you would not spot me even 5 years ago. People would not have spotted me as someone who was autistic. The world has changed a lot. So in some ways that are really good.
Mhm.
I still find some of the portrayals in public media of autistic people to be really stereotyped and annoying. Um, this socially awkward, often embarrassing, usually extremely smart male who's just incredibly awkward and says all the wrong things. I mean, there's
Yeah.
so many examples of them. Now they're more often they're showing female versions of that character. They still have all those characteristics, but they're female. That's way behind what we know about the autistic community now,
Yeah.
and gets more and more frustrating to see. I'm glad. autistic coded and neurodivergent coded people are showing up in more spaces. And more people are coming out and saying, I've got ADHD or I'm autistic without any shame or embarrassment. That's awesome. We need more.
Yeah. It's becoming normalized. And I think just because we're hearing of more cases doesn't necessarily mean that it's happening more often. There's just more of an awareness about it. That's at least my perception. What do you think?
You don't find something that you're not looking for.
Mm-hmm.
So now we know that we know where to look in more cases. There's less stigma. There's still a lot of stigma, but there's less stigma than
Yeah.
there used to be.
Yeah.
More people. It used to be you had to go to a specialist that was very hard to find and very expensive and was not covered by insurance to get your diagnosis if you wanted one. More and more people are just self-identifying, and
Mm-hmm.
within the neurodivergent community, that's accepted because we know exactly how hard it is to get officially diagnosed, and you may or may not need an official diagnosis unless you want accommodations at work or school or you want to file for disability or whatever. Um, if you just suspect you're autistic and you do your research and you fit the profiles and you've done the online screening tests, which are pretty easy to access and complete, and it looks like there's a high probability that you're neurodivergent, um, welcome.
Yeah.
We
I love
won't
that.
we won't question that. Well, most people will not question that. There's
Right, that makes sense. Yeah, because I think about, within TikTok culture, I feel like there's a lot of self-diagnosing there.
yeah
But that can also like really give people a voice and really give people that validation.
yeah.
And so, yeah, that's complicated. It's unofficial, but it's so validating and it's so helpful.
And
Along with,
it also creates its own issue because now there's this meme going around that everyone is neurodivergent, and sometimes that's meant in
yeah,
a compassionate way. Um,
yeah.
more and more people are feeling comfortable with the idea that neurodivergence is not rare. But this
Mm-hmm.
idea that we're all neurodivergent, number one, is not true.
Yeah.
Yes, we all have nervous systems, and there's a spectrum of all the different aspects of it.
Mm-hmm.
But if you're one of those people, I think of it sort of like a bell curve. If you're one of those people who's in the standard deviation of the bell curve, and you say, yeah, I'm neurodivergent too, well, maybe you have some traits and you have some moments when you're odd or socially awkward or don't make eye contact or whatever,
Yeah.
but you don't have the same experience as the people who are farther toward the extremes. And to try to claim that is even if it's meant well, it has some problems. It's like when people who are within the Black community and have experienced a lot of violence and racism and oppression try to call out for recognition of their experience, and the response they get is, well, all lives matter.
Yes.
It's not, I'm not making an equivalence there of the level of suffering or pain or any of that.
Yeah.
Um,
Yeah. Yeah.
but it's a similar kind of dynamic. It's trying to make something that's very difficult invisible and, take some, say, I claim part of that too.
Yeah.
Uh, that's not entirely fair, even when it's meant well. Now, when
Yeah.
you say I'm neurodivergent and someone says, well, maybe I am also. Tell me more about that. What helped you identify that and spot that? And they start considering, well, maybe I've got some ADHD myself. Maybe I'm autistic. Maybe I should, take my dyscalculia or my epileptic issues more seriously. Maybe
Mm-hmm.
I'm not alone. Maybe I have permission to explore that more fully. Now that's a beautiful thing. That's why, by the way, this population is exploding so fast because those conversations are now happening at a much higher
Mm-hmm.
rate. It's always been there. And if you read Neurotribes, which is a brilliant journalistic book, he
Okay.
traces it back at least 250 years. And there are people who argue that there have been autistic and ADHD people as long as there have been people. An ADHD person is an excellent hunter-gatherer. They will miss nothing in the forest. Just don't ask them to
Yes.
keep your campfire lit. Um,
Yes.
Autistic people are really good at advanced planning for complicated situations and putting things together in very new and innovative ways and thinking for the future. This is where we get farming and agriculture and cities and planning and all that kind of stuff. Now, these are exaggerations, obviously, but
Right.
um, they've always been there. We've always been there.
Yeah.
We,
And I love how you're highlighting the strengths.
Mhm. I try to. There,
Yeah.
there are definitely a lot of challenges, and sometimes, even with all my privilege, life is sometimes very hard.
Yeah.
That doesn't make me a victim, and I'm not trying to claim that I'm somehow disabled. I'm not. In most cases, I'm fairly abled, but there are times when I go through burnout on a regular basis. One reason why I'm considering hiring people to expand my practice because I just can't just see more clients.
Hmm.
And I experience all those problems and meltdowns and shutdowns that other people do. Hopefully not as often because I have, at least theoretically, have some skills for managing it. Good at teaching other people, not always so good at implementing it myself. But yeah, it's an interesting world. Uh,
Yeah. So I'm curious how like marketing would change with you being so niche down and just such a unique niche that really needs specialized skills. Like what's your marketing strategy? What could listeners really take away? Any tips or anything?
So, I marketing for me is not a problem. In fact, I have my Psychology Today profile has said I'm not accepting new patients for a really long time.
Wow.
Um, I still get a lot of inquiries through my website, and I get
Okay.
referrals and word of mouth. I mean, this community of autistic specialists, especially, is so small that not only do I not need to market, there are times when I wish I could take my website down because I just can't respond to them all.
Yeah.
Um, and that actually suggests a tip for people who are just starting out. There's a lot of discussion about niching versus generalizing.
Yeah.
I am strongly in favor of a niche as long as that niche is underserved.
Hmm.
So, if I was trying to specialize in, say, anxiety or depression, good luck. I mean, you can't swing a cat in some communities without hitting someone who claims to be a therapist specializing in that. But a
Yeah.
community that is heavily underserved, like autism, I mean, if there's someone, I saw you had another guest who specializes in people with chronic illness and
Hmm.
disability, massively underserved population.
Yeah.
Um, if a good advice that I got when I was first considering becoming a therapist was to work with children because it's hard to find good child therapists, especially child and family therapists, ones who work
Yeah.
with the family system, not just the individual child. Um, if you have an interest and a passion or a lived experience that is unusual and where there are not a lot of therapists, and you can go out there on Psychology Today and look, not a lot of therapists who are truly expert in that, or you have a talent that would lead you into something like art therapy or music therapy or sports performance therapy, things like that. You won't need to market for more than a few months. My practice filled within, I think it was about 6 weeks after I listed my Psychology Today profile. I invested in a good website that helped.
Okay.
Um, if you're just a generalist and you don't have a niche, it's much harder. Your competition, especially in cities, is much bigger.
Yeah.
Um, but also these days, all the therapists, licensed therapists that I know in private practice, are full because the demand is just so huge. At least in this rural area that I live in. Um,
Mm.
so there are several books that help me develop this business quickly and well. Lynn Grodsky has two of them that are just amazing. Um,
Okay.
The New Private Practice and Building Your Ideal Private Practice. Megan Gunnell, who is also serves as a coach for therapists about business practices and has a great program, has a book called Thriving as a Therapist. Listening to some podcasts, The Practice of the Practice, for example. The Rebel Practitioner, I think, is the name of another one, Rebel Clinician. Kim Tolson has two excellent podcasts, one on using AI and one on called The Traveling Therapist, which fundamentally changed the way I thought about the possibilities of what a therapist can do, because I now go back and forth to Peru and Mexico for several months a year, and still continue seeing my clients. Never occurred to me you could do that until I came across her podcast.
Yeah.
And not just talking to people, stay in contact with the people from grad school and the people from your jobs, and just see where their paths take them. Sometimes it's in very surprising places. So,
Yeah.
I was willing to make a fundamental shift in how I thought of myself and my ideal clientele based on what worked. For example, I stopped doing couples therapy because it turned out I'm just not good at it. It takes a special skill set and a special personality to be able to say, I don't know what your experience of couples therapy has been, but for me, it's usually sort of a mediated argument that picks up every week. Hard to sit with. By the time people actually come to that setting, often the problems are pretty hardwired.
Yeah.
So,
Yeah, that's tough.
so follow your bliss, as Joseph Campbell would say. If you find that you're really enjoying something, or there's a certain type of population where you just feel good, not stressed after you've had sessions with them, don't be afraid to say, okay, I'm going to stop doing this that brings me stress, and I'm going to start doing more of this because I enjoy it.
Yeah.
It'd take a while to find those things and some experimentation, but as you get new information about what brings you joy and peace and grounding, do more of that. It's the secret of mental health, right? It's not complicated. Less stress, more fun.
Well, yeah, that's a system that I feel like is proactively preventing burnout, and
Mhm.
I do feel like in our grad school programs, like they really push the self care and they really push the caregiver burnout and just be aware of that and whatever, but it's really vague.
Yeah.
Right? We just get statistics about it. We just get information of like, okay, don't burn yourself out. Okay, now go on to your internship. And so it's really easier said than done.
I had to develop a whole course in collaboration with a local agency here to address that caregiver burnout, whether it's
Yeah.
parents, teachers, medical people, therapists. We were losing nurses in the integrated setting that I was in. We were losing nurses so fast that we couldn't staff the health centers.
Ugh. Oof.
At one point, I think it was 2022, when they did a poll, something like 25% of all physicians were thinking about leaving the profession completely within the next 2 years. Now, this was just post-COVID.
Right.
Teachers are leaving so fast that schools are struggling.
Yeah.
And parents, let's not even talk about parents and caregivers. Often grandparents too.
Mm-hmm.
So, and yeah, the Surgeon General came out with a report in 2021-ish, around COVID time, declaring a national emergency about healthcare staffing. And he diagnosed the problem perfectly, but all of his recommendations were the same stuff: better self-care, take time off, go talk to your friends, take a bath. Come on, people. We're talking about Band-Aids on an amputation.
Yeah.
So, and especially in the population I work with, autistic burnout is normal burnout turned up about 100%.
Yeah.
It's a whole different thing. So,
Yeah.
I work a lot in stress management with the population that I do. And a lot of the recommendations that I come up with are things that I learned from OT. There's a great website, the OT Toolbox, that has so much information on there about sensory and somatic strategies for managing stress. And you really do have to do those things and be willing to fundamentally change your life if you need to.
Mm-hmm.
That's why I opened the practice I did and work fully online from my home. Usually, my dog's not in here right now because he would probably be noisy on the microphone, but he'd love to be a therapy dog in practice. But
Mm-hmm.
you do what you have to do to make your life manageable.
Mm-hmm.
And sometimes that means radical choices. I had to leave an agency I loved and a school that I loved working in
Wow.
because they were trying to enforce the return to work policy after COVID. And I just couldn't. There was no way to make that work in my life. And being in an elementary school with 630 kids in it when it was built for 300 with an office one wall away from the cafeteria uh,
Ooh.
where they had the kindergartners and fifth graders sharing lunchtime
Yeah.
um, was more than my nervous system could handle after a while. So it would
Yeah, no
either make
kidding.
some radical changes in how I was approaching my work and my life, or accept the fact that I was going to be very sick for several months a year and eventually would have to leave the profession at a much earlier age than I would like. I'd love to continue doing this into my 70s and 80s. There's no reason why I can't. I mean, Irv Yalom, I think, is probably close to 90. I think he's still alive, still writing a few years
Yeah.
ago. But
Wow.
as long as your brain is working and you're able to speak in some way, therapy is a profession you can keep doing for a really long time if you
Yeah.
can make it sustainable for you.
Yeah, that's the catch, right?
Yep. And give yourself permission to rest, which is usually the hardest part because we are often very driven people who want to help. And many of us have a hard time saying no. No, I really can't work in another client. I would love to. I've got a couple blocks of time in my day that I could squeeze them into, but that's my time to go walking the dog or having lunch with my wife or spending time with my children. And those things matter. So
Yes.
learning to
I
say
love that.
no is really important.
Hmm.
Prioritizing your own life. It's the old oxygen mask rule.
Right. Yeah. Like, and also our work supports our life,
Mhm.
right? Not the other way around. Like, we're working to live.
Right.
And so I really like that perspective. Like, that actually sounds like a sustainable plan. So for those entering the field now, knowing everything you know now, what would you tell people who are at that stage? Like they're just starting grad school, or maybe they're looking for programs, they're getting ready to commit to one before the next semester.
Mhm.
What would you say to people at that step in the journey?
Considering grad school or already in grad school?
Let's say considering grad school. Yeah, let's start at the very beginning.
Um, I do still think that social work is kind of a good sweet spot. It's kind of like
Okay.
as in the therapy world, it's similar to what nurse practitioners are in the medical world. You're able to do most of the things that are available in mental health. You can't prescribe and you can't do certain psychometric testing,
Yeah.
but you have a higher level of qualification and pay and ability to bill insurance companies at a higher rate than LPCs or the other sort of master's level. Social
Mm-hmm.
workers and MFTs are parallel in that respect. MFTs are very rare outside of California. That's another good path that I encourage people to do. Um, I would encourage people to really study the full range of things beyond what's just given in grad school and try to identify early where their passion is.
Yeah.
Um, is it working with kids? Is it working in hospice care? Are you drawn to working with seniors facing existential questions at end of life? What's your jam? And then search for. You're not going to actually talk to the professors and get to work with the leaders in the field. You just won't. So looking at the faculty list is not relevant. It changes so fast.
I
But
agree with that.
if you find a university or a program that specializes in something that you're passionate about. Like they have coursework. You can look at the course catalog. They have actual coursework in, say, autism, and it covers more than just the diagnostic criteria. Or they have an actual program around family therapy, um, and people who really know family systems work. Um, those are good indicators. Um, there are some degree mills out there that I won't name that I've seen people come out with good training. I've also seen people have a really hard time getting good placements.
Okay.
Um, go with a reputable program. Um, it's hard to find reliable rankings of them, but
Yeah.
in our area, Portland State has an amazing social work program. George Fox has a good sort of LPC directed program, and I think also social work, more sort of faith based. Simmons is a really good nationally known program. USC also for social work, although it is ridiculously expensive. I think because it's funded in part by the VA for their military social work program, which allows them to raise rates. But talk to some graduates, talk to as many people as you can. Talk to the places in your area where you would likely get your placements
Yeah.
and see what they regard as well respected institutions in their area.
Okay.
That's probably the best way to find out where they see the best people and the quality of the training those people are getting. Talk.
Mm-hmm. Yeah, I mean, it's a big investment, right?
It's huge. It's a big investment of your life.
Yeah.
Um, it's and also just understand that you will probably have to do your time in community mental health or a hospital, depending on
Okay.
your path, somewhere because the between the insurance companies, the boards, and the agencies, there is kind of a an agreement, whether spoken or unspoken, that that's where you're going to get your training, and it is boot camp
Mm.
in most places. So
It is kind of considered the default.
yeah, and
Yeah.
it'll take the average person, depending on your degree, 2 or 3 years to accumulate the hours. The supervision hours are usually the barrier, not the client hours.
Okay.
Because finding a supervisor who meets with you weekly, which is kind of how the math works, is
Yeah.
tricky. Supervisors are
Yeah.
busy. So often people will get the client hours and then it takes them another 6 months to a year to finish up the supervision hours. They don't often realize you can hire an outside supervisor if you're privileged enough to be able to pay for it and then increase your rate, your time.
Mm.
Um, but you will have to go through that hurdle most likely. There are a few paths that get around it, but they're complicated and take more time. So,
Right. It seems like it's so messy and it's like it's different for every state. And I also hear, like, at least from the population on my channel, a lot of fear around the paperwork with the state boards and just like all of those requirements and keeping track of everything because everything's listed on the state board's website and then it's
it's
worded in a confusing way.
yeah, it's not as hard as you might think. I mean, your supervisor
Okay.
will help you figure out that aspect. The hard part is actually the stress. Your case typically the caseload is much higher than what you should have and
Okay.
can easily handle. Um, it,
Yeah.
it's a difficult thing because you need the hours, but um, it is really hard to be a brand new therapist working with, in my case, it was 45 to 65 clients at a time, working part time.
Yeah.
Um, that was hard. Just grit your teeth and get through it, and then the world is open to you. Once you have your license, you are free to go.
Yes, you can take all the insurances so it gets
It's
easier.
hard to work
I
on
feel
that
like to keep
process.
people.
So
Yeah.
I do have a client that I have to go to. What I think would be helpful, maybe if you're interested, would be a follow-up
Yeah.
conversation about that aspect of it. How do you get through the actual training, and then what? Once you get your license, what are some paths that can be available to you? Because that's an interesting conversation that I would love to get to.
Yes, for sure. David, thank you so much for coming on. And to my audience, I'll have David's links in the show notes and in the little caption underneath his name. So, David, thank you so much again for just giving so many resources to my audience and talking about what it's like with your specialty and with your practice.
And I don't know if it came through, but if you are licensed in Oregon or California, especially, and you are interested in working with a neurodivergent population and have some training in that, reach out to me because I am looking for people, like actual people
Yes.
that I can pay. So,
Ooh, okay. Yes, so I'll have that information in the show notes as well.
okay,
Thanks again, David. I'll
all
I'll
right,
let you get to it. You have a fabulous day.
take care.
Take care. Bye.